I'm going to officially kick us off for tonight's webinar. So good evening, everyone. My name is Andrew Velpe. I'm the Marketing and Communications Manager here for Fear Free, and I'll be your host and moderator for tonight's Fear Free's Top 5 and 15 webinar. We are so thrilled to have you here with us tonight, and we'd like to extend an extra warm welcome to all of you veterinary students attending tonight's presentation on the top 5 things you need to know about pain with Dr. Mike Petty. Before we dive in, I'm going to share a few housekeeping notes for you. So as I mentioned before, your microphones will remain muted throughout the presentation just to reduce the background noise. If you do have questions, as I've mentioned before, please feel free to type them in the chat. We're going to do our best to address as many of those as much as possible during our brief Q&A session at the end. For those of you unable to attend tonight, you're probably not watching this live, but a copy of this recording will be made available to all of you within the next 2 weeks and sent directly to your email address. This webinar is part of our Top 5 and 15 series brought to you by Fear Free, where we aim to provide you with quick, actionable insights to help you better prepare for your future in veterinary care. For those of you unfamiliar with Fear Free's mission, our mission is simple. It's to reduce fear, anxiety, and stress in pets by educating the people who care for them. If you're interested in learning more, you can certainly visit fearfree.com and be sure to follow us on social media just by searching up Fear Free Pets for updates on our future webinars. Tonight's Top 5 and 15 series is also brought to you in part by the Veterinary Business Management Association. Now, we're incredibly fortunate to have Dr. Mike Petty. There he is with us tonight. Dr. Petty is a globally recognized expert in veterinary pain management. He is currently a member of the World Small Animal Association's Global Pain Council and a past president of the International Veterinary Academy of Pain Management. With a wealth of experience, Dr. Petty has taught primary care veterinarians around the world about anesthesia, analgesia, and chronic pain management. He is also the author of the book, Dr. Petty's Pain Relief for Dogs, published in 2016. Dr. Petty's insights will undoubtedly provide you with valuable knowledge that can enhance the care that you provide your future patients. Now, without further ado, I'm going to step off stage and turn it over to Dr. Mike Petty. Dr. Petty, take it away.
Thanks, Andrew. Okay, so I got a really good introduction there. Andrew's going to present the slides here, and here's our first one. So just a little bit about my background. I'm a veterinarian, as you know, and I graduated before probably every one of you was born back in 1980. So I've been doing this for a really long time, and it hasn't always been about pain management. When I graduated, there weren't things out there to treat pain management, and the knowledge about it was really poor. I was lucky enough that I worked in high school for a veterinary team that, believed in doing things like local anesthetics and morphine and so forth for their surgery patients, which was absolutely unheard of at the time. And then I went to veterinary school, and a lot of those things weren't done. And I've always known there's something that could be done better. So the other thing I want to say about myself is, so I've been practicing since 1980. If there's a mistake to make in veterinary medicine, I have probably done it. As we get more and more knowledge, we realize, the better way to do things and so forth. And, unfortunately, by the time, we end up retiring, we're at the peak of our knowledge. And this is why I love lecturing, especially to young students, to kind of carry some of that knowledge forward. Next slide. Andrew, can you hear me? Next slide. Thanks. Okay, so this is a quote by the poet John Donne. Instead of no man, I've updated it to the 21st century of no person is an island entire of itself. We cannot exist without other people around us. We are meant to be social people and, in our daily lives. And, people that live alone don't live as long. They have all sorts of mental health issues and so forth. And, I think that, one of the things that we have to carry this idea over into our professional lives and really say, we need others around us in order to do the best job that we can possibly do as a professional. Next slide. So on that theme, it is all about diagnosing teamwork is essential in diagnosing and managing pain. And if you look at that little puzzle there, it's all put together with 5 different categories: veterinarian, receptionist, vet technician or nurse, the pet owner or caregiver, and the animal. And as a veterinarian, you are both the least important in that puzzle and also the most important. Why are the least important? You cannot do a job unless you have empowered everyone else on your team to do their job properly and to come to you and talk to you about their thoughts and perceptions. And I'm just going to give you a really brief example. One that I really like. My receptionist was talking about how she will get people that will call up and say, oh, I need to bring my dog in for whatever, a rabies vaccine, an ear infection, whatever it might be. And she'll say, okay, how about 2:00 on Tuesday? And they go like, oh, no, it's got to be after 4 because my dog can't get in the car by itself anymore. Now, if the receptionist didn't write that down, the dog may have come marching in, seeming just fine, because it's not jumping into a car to walk across the threshold to your clinic. And if you don't have a hint that there might be something going on. At the same time, your technician doesn't know to maybe talk to the owner about this trouble of jumping up into a car, and at the same time can also hand out a pain scale, which we'll talk about a little bit later. And then we have to both let the animal be in a relaxed environment so that the animal can talk to us and we can observe it. And we have to listen carefully to the pet owner. And I'm going to cover that in one of my next steps. So you really need input from every team member. So you are going from the least important, if you don't listen to anyone, to the most important when you can put this entire puzzle together and come up with both a diagnosis and a treatment. Next slide, Andrew. All right. So there's a movie out, 1944, before I was born, but it's called Gaslight, and it starred, I think, Ingrid Bergman and Joseph Cotten. And basically, this is a movie about this woman who was the male character was trying to drive her crazy. And he kept having the gas lights in the house go up and down in volume. And she'd say, why is that dimming? And he'd say, it's not dimming. It's not dimming. What are you talking about? His intention was to drive her nuts. But we can gaslight a client's concerns, not to drive them nuts, but to ignore them. And that has big consequences. So next slide. You have to listen to what the client has to say. If you don't, that's gaslighting them. And I absolutely promise you, the longer you practice, the more likely you are to make your diagnosis fit your preconceived notion of what is going on. As a veterinary student and a new graduate, you're going to see an animal come in with whatever you want it to be. Let's say it's anemic, and you're going to have 101 possibilities in your head. As you become more and more proficient at practice and diagnosis, you're going to be able to look at a couple of other indicators and say, okay, it's probably not this, it's probably not that. But at the same time, the kinds of cases that you have come in are going to shape your diagnostic path as to how you go. And there's always a danger of trying to make a couple of factors fit into what you want what your brain wants the diagnosis to be. We don't do this on purpose. This is a way for our brain to really kind of consolidate things, put things in file drawers and so forth. And it makes us make really quick decisions in what's otherwise a dangerous world. But in the office, it's not a dangerous world. And yet our brain tries to say, oh, I see this, so therefore it's got to be that. And I'm going to worry about that, not this. So if you want to lose your client's trust by doing this, go ahead. They're going to think, wow, I just said that, and my doctor didn't even acknowledge he doesn't listen to me. Or maybe the client says something to you, and you say, okay, but let's talk about what I think it is. My doctor doesn't believe me. So in the end, why should I follow their treatment recommendations? Why should I give these expensive pills? Why should I ever go back and see him? So always listen to what your client has to say. This is really important, especially when it comes to pain management. Next slide. Use pain scales, preferably validated ones. Next slide. So I want everyone to get their smartphones out and take a picture of this slide because there's a lot of information on this. And I don't expect you to write it down or memorize it as we go through. On the left-hand side, I've got several acute pain scales. I really like all the grimace scales that are coming out. Why? You've got a distant observation of the animal. You know, as soon as you interact with the animal, it's going to change the way that they are acting. And if you're interacting with them, they are going to go into this, what I call don't eat me mode. You know, all of our small animals are carnivores, but they're small carnivores, and they're prey for larger carnivores. And they want to put on as best of a show as they can. Luckily, we have for cats a feline grimace scale, and there is the URL. We don't have one yet for dogs. They're out there for mice, for rats, for rabbits, for ferrets, but no one's been able to get a validated one for dogs. So for dogs, I like the Glasgow Composite Measure Pain Scale. On the other side, we have the chronic pain scales, and I've listed two of them. One of them is out of Pennsylvania. The other one's out of Liverpool, the UK, and they're both really good pain scales. For cats, we have one out of Montreal and we have one out of North Carolina. They all work well. My important message to get to you is to look at it and find one that you're comfortable with and that your staff is comfortable with. Because remember, teamwork, right? You're probably not going to be giving these things. You're not going to be back there observing the animals in pain. Your veterinary nurse or technician is. Your veterinary nurse or technician is going to be the one that's going to be talking to on intake to the client about possible pain issues. Next slide. It is easier to anticipate acute pain than to chase after it. This one took me a little bit of a while to learn. Next slide. You as the veterinarian do not have the time for constant monitoring, but you've got to empower your nurse to make sure she does. Don't let her go back. Let her talk to all of these animals, or talk to the animals, look at all these animals and make observations and try to decide what their pain condition is. Then you also have to give them the power to administer pain meds without coming to you and asking. Because when they see this, the animal needs it right away. If they wait too long, they wait till you're at the end of a 15 or 20-minute appointment, then they're going to be giving a way higher dose. Of course, they don't have the education you do, and you may have to set up some parameters. You know, an animal can have certain diseases that might preclude certain medications or adverse events to certain drugs, and you have to have that down. If you need to give something, remember, you can't give dexmedetomidine because this dog has congestive heart failure, things along that line. If you don't, you're going to be given too much medication if you have to chase the pain, and you're going to be dealing with all the problems that go with that. The dysphoria, the dog going home, acting gorped out for 4 or 5 days, the owner being unhappy. Next slide. Okay, this is our last point. Pain is inexorably linked to fear, anxiety, and stress. Next slide. So I call this two sides of the same coin. And there was a study in the United Kingdom that showed that 60 to 80% of all behavioral issues have their foundation in chronic pain. 60 to 80% behavioral issues. And I don't know how many decades I spent in my career trying to treat behavioral issues as behavioral issues when I couldn't look past and see that really the problem was the animal was in pain. And I can remember when I first started getting pain management, there were a couple clients that said, "Hey, by the way, doc, my dog used to be really grumpy around all the other pets. Now he isn't. As you know, after you put him on Rimadyl or whatever it might be." And I was like, "Oh wow," you know. And this was all validated when this study came out. And if you look at the picture of that brain You've got the pain center and the emotion center. They're nested right up against each other. It's why when you slam your finger in, a cabinet or something, it's hard not to have a 4-letter word immediately come flying out of your mouth because of the close link of those things. So this is the last slide, and I'd like to open this up to any chats.
Great. First and foremost, thank you. A big thank you to Dr. Petty for your time and insights tonight. And of course, that gives us your
Andrew, you kind of froze up there.
Valuable tips. So thank you for sharing that. We are going to open. Oh dear. Am I here now? Am I back?
Yeah, you're here now.
Am I back now?
You're back. Yeah.
Okay. Wow. Technology in 2024 is wonderful, folks. What I was saying was we do have the chat open. We have Dr. Petty here for a few minutes. So if there are any burning questions, please feel free to throw them in the chat and I'll get the party started here, Dr. Petty. On your last slide, you talked about the two sides of the same coin. And we touched on a little bit about how that feeds into fear, anxiety, and stress. At Fear Free, obviously, with your experience with us, we try to reduce fear, anxiety, and stress even before the veterinary visit. From your own experience, Dr. Petty, when a pet comes in at, let's say, a fear, anxiety, stress level 4 or 5, and they're already in pain, how do you work with that pet to reduce their anxiety first before you can kind of start that treatment?
Okay, so unless an animal comes in and it's on fire or it's bleeding to death, there's no treatment that is so necessary that it has to get done that moment, okay? So there's a couple of ways I handle it. We will sometimes ask the client, can we give you some anxiety medications? Not the client, but the animal, and if you come back. Or, sometimes if it seems like it's a little more critical, we'll do something injectable. And I've found over the years that if animals that you do treat with stress medications, whether by pills or injection, every time they come back, it's always just a little bit easier.
For sure. And I think that's kind of the big thing too, that a lot of veterinarians are learning as they go through Fear Free is, unless it's a critical emergency 911, sometimes it's okay to delay treatment if it means just getting that pet familiar with the routine and getting them more comfortable with being in your presence. So appreciate you sharing that with everyone.
Right.
It seems that we have kind of a shy audience tonight, Dr. Petty. So I just want to give everyone in the audience, I know there's a few of you left here, one last chance to ask any questions you might have on the topic of pain. You've got one of the best in the industry here to share that resource of knowledge with you. So I'll give it one more minute here if anyone does have any. One of the things that I also liked is what you said, and I think it was the second or third slide, listen to what the client has to say and, building that trust. That's such a huge thing. It's one thing to come in and want your pet to be well, but part of that is having that dialogue with the pet owner as well. So it's super important to build that trust. And it looks like we have our first question, so I don't have to stall much longer. I have two questions. So Azara is asking, what is your recommendation in reducing FAS for critical patient or in shelter setting?
So, trazodone is my friend. That's a drug that we've really only started using in the last decade. And trazodone in time, you have to go slow. You have to gain the trust of a lot of these animals. And it's, one of the things I really like is to get down and sit on the floor and let an animal come and look at me. And to, if it's a cat that's afraid, put it in the exam room and let it walk around for 5 or 10 minutes before you walk in, and don't have people coming in and out the door. Every time someone opens the door on a cat, it's like it's a whole new setting and they get ramped up again. So, trazodone, time, again, if you can delay it, have them come back a different time. If it's critical, consider an injectable so that you can treat that animal in an important.
Great Great question. Great answer, Dr. Petty. Thank you so much. And thank you, Azara, for that. Looks like we have another one here from Chantel, sorry. In regard to chronic pain being 60 to 80% of behavioral issues, what about the rate of behavioral issues in vet clinics only due to one-time pain or negative experiences in the clinic? And the second part of that is, how can we break down that fear after a negative experience?
Yeah, well, this all comes down to how are you going to practice? And, in my clinic, for example, we do not do nail trims. Why do we want to do a nail trim? It's one of the things that dogs and cats fear the most. And every time they come in, they think, oh my God, I'm here for a nail trim. And we don't want that. So we don't do it. Just taking out nail trims in our regimen reduce the number of fearful animals that came in. And the other thing is like the one-time thing. You've got to anticipate. You've got to know what's going to hurt. And you've got to be able to treat it both before, during, and after. And, as I explained early on in my lecturing career, why do we have puppies that come in and they're all happy and wagging their tail and their butts and they're happy to see us and they don't mind the injections because we try to do a good job, and then we spay or neuter them. And then they come back 2 weeks later for sutures. They're terrified of us, and they're terrified of us maybe forever. We didn't do a good job on the pain medication, right? So we have to, again, anticipate what's going to hurt, know what procedures are going to hurt, and take the time and the precautionary treatments to not allow it to happen.
Excellent. Thank you for that, Dr. Petty, and thank you, Chantel. Well, folks, I think that's going to do it for tonight's presentation. So once again, a big thank you to Dr. Petty for his time and insights tonight. Let's give him a big 5. All of the time he's given us tonight. Throw some 5s in the chat. On behalf of Fear Free and our friends at the Veterinary Business Management Association, we also want to extend our gratitude to all of you for attending this Top 5 and 15 webinar. We hope you found it helpful, and we encourage you to apply some of the techniques you've learned tonight in your future practice to help reduce fear, anxiety, and stress in your patients. As a reminder, the recording of today's session will be emailed to you within the next 2 weeks, so keep an eye open for that. In the meantime, be sure to follow us on social media at Fear Free Pets for more educational content and updates. We are excited to continue bringing you the webinar series, the next one coming up on November 12th, focusing on the top 5 pitfalls of the emergency room. So you can be sure to register for that at fearfreepets.com/5 in and then the number 15. We hope you have a great evening. Thank you again, Dr. Petty, and thanks to all of you for being part of our Fear Free mission to make veterinary care both better for pets and people. On behalf of all of us at Fear Free, have a wonderful evening, folks. We'll see you again soon.
Thank you so much.